What is post-traumatic stress disorder? PTSD. Post-traumatic stress disorder, PTSD, is a mental health disorder that some people develop after they experience or see a traumatic event. The traumatic event may be life-threatening, such as combat, a natural disaster, a car accident, or sexual assault. But sometimes the event is not necessarily a dangerous one. For example, the sudden, unexpected death of a loved one can also cause PTSD. It's normal to feel afraid during and after a traumatic situation. The fear triggers a fight or flight response. This is your body's way of helping to protect itself from possible harm. It causes changes in your body, such as the release of certain hormones and increases in alertness, blood pressure, heart rate, and breathing. In time, most people recover from this naturally, but people with PTSD don't feel better. They feel stressed and frightened long after the trauma is over. In some cases, the PTSD symptoms may start later on. They might also come and go over time. What causes post-traumatic stress disorder, PTSD? Researchers don't know why some people get PTSD and others don't. Genetics, neurobiology, risk factors, and personal factors may affect whether you get PTSD after a traumatic event. Who is more likely to develop post-traumatic stress disorder, PTSD? You can develop PTSD at any age. Many risk factors play a part in whether you will develop PTSD. They include your sex. Women are more likely to develop PTSD. Having had trauma in childhood. Feeling horror, helplessness, or extreme fear. Going through a traumatic event that lasts a long time, having little or no social support after the event. Dealing with extra stress after the event, such as loss of a loved one, pain and injury, or loss of a job or home. Having a history of mental illness or substance use. What are the symptoms of post-traumatic stress disorder, PTSD? There are 4 types of PTSD symptoms, but they may not be the same for everyone. Each person experiences symptoms in their own way. The types are 1. Re-experiencing symptoms, when something reminds you of the trauma and you feel that fear again. Examples include flashbacks, which cause you to feel like you are going through the event again, nightmares, and frightening thoughts. 2. Avoidance symptoms, when you try to avoid situations or people that trigger memories of the traumatic event. This may cause you to stay away from places, events, or objects that are reminders of the traumatic experience. For example, if you were in a car accident, you might stop driving. Avoidance symptoms can also include avoiding thoughts or feelings related to the traumatic event. For example, you might try to stay very busy to try to avoid thinking about what happened. 3. Arousal and reactivity symptoms, which may cause you to be jittery or be on the lookout for danger. They include being easily startled, feeling tense or on edge, having difficulty sleeping, and having angry outbursts. 4. Cognition and mood symptoms, which are negative changes in beliefs and feelings. They can include trouble remembering important things about the traumatic event, negative thoughts about yourself or the world, feeling blame and guilt, no longer being interested in things you enjoyed, and trouble concentrating. The symptoms usually start soon after the traumatic event, but sometimes they may not appear until months or years later. They also may come and go over many years. If your symptoms last longer than 4 weeks, cause you great distress, or interfere with your work or home life, you might have PTSD.